Many people have welcomed sweeping new reforms from the New South Wales government that will help people with treatment for ADHD, but some are sounding the alarm bells.
If your child finds it difficult to concentrate, tends to talk a lot and can't keep still, you've probably been told to consider an ADHD diagnosis.
So I sought out a diagnosis for my daughter because I could see some deficits in the way that she was approaching some learning tasks.
But for many, a diagnosis is out of reach, often taking months or years to see a specialist and in some cases costing thousands of dollars.
It's never a straightforward path. The wait times to get onto a paediatric wait list are extraordinary. So to go through the public health system, you're looking at 2 to 2.5 years. For us to go through a private paediatrician, we were told 2 years.
It's a problem the New South Wales government is addressing, with new reforms allowing general practitioners to diagnose ADHD and prescribe treatments.
The Australian way is you are able to access the healthcare treatment you need regardless of where you live or how much money you have. And this is about making sure that that is true for conditions like ADHD.
Hopefully it will remove some of those barriers and just make the process easier. I think that as long as we continue to have a rigorous process around the diagnosis, then really all we're doing is ensuring that kids get the right support that they need.
But critics fear it could create the perfect storm for over-prescribing.
The overdiagnosis problem or the misdiagnosis problem may get worse because obviously GPs aren't as specialised.
The number of Aussie kids prescribed ADHD medication at its highest point ever, rising more than 18% in the last financial year alone. In some areas, more than 1 in 10 kids are using medication to treat a mental health-related illness.
It needs to have safeguards built in, and I think the criteria themselves need to be looked at and tightened up. I think these days it's softened and we've got into an area where people might have a need for care for something and they may be struggling in life, but they're latching onto this label when it may not be the right fit for them.
So, are we over-prescribing a serious medication or finally addressing a long-standing health problem for our kids?
Professor Ian Hickie is the co-director of the University of Sydney's Brain and Mind Centre. Professor, should we be worried about an over-prescription of ADHD medication?
We should really worry about inappropriate prescribing. There's quite high figures and the figures have been going up, particularly in teenagers in Australia. And so there's a real concern about the appropriateness. Who's getting medications? Are they the kids in most need? And are they having the desired effect on educational and behavioural outcomes?
Why do you think those figures are so high?
More people are seeking out help. There are more clinics available, certainly more commercial clinics available than there were, so more people are seeking help. But as we've seen in New South Wales just overnight, the New South Wales Premier wants to expand that further through GP prescribing, at least in New South Wales, because of those who miss out. So it's a combination of awareness and availability, but we've got to really worry about the appropriateness in most situations.
Sorry, so can we be clear? Do you think there is inappropriate diagnosis going on or prescription? Sorry.
I do think in some areas that's the case. We've got the situation of over-prescribing where there's been inadequate assessment, really taking into account a kid's full history. So we have commercial clinics, I think, which are not doing a great job, but in other areas we have a lack of access to appropriate assessment.
Sorry, I just want to decode some of the language there. So when you talk about commercial operations doing this, are you suggesting that in some places we're getting over-prescription because people are making money out of it, and if they weren't, or if that profit motive weren't there, they perhaps wouldn't be prescribing?
Exactly. So we've seen very simple commercial operations set up, fill in a questionnaire, come in, pay a large fee, expect to get a script. That's not good practice. In other areas, kids can't get appropriate assessment, medical assessment, psychiatric assessment, neuropsychological assessment, to make sure they are the kids who would benefit most from prescriptions of these types of medicines.
OK, so it's worth pointing out that we are talking about really quite serious medication here. The side effects, this is just what I've gleaned from reading, you can tell me if I'm wrong, but they can include reduced appetite, sleep problems, mood changes, increased blood pressure, even tics or psychosis in rare cases. The New South Wales government, in saying GPs will prescribe this sort of medication, they'll be trained up. How much additional training do you need to be able to prescribe that sort of thing to this sort of condition?
Well, you need to have the training, but perhaps more importantly, you need to participate then in practice accreditation and tracking, seeing whether what you're doing is appropriate, working with other specialists, with psychologists, with developmental paediatricians, working in teams to actually make sure the assessment's good, but then the tracking of the outcomes, you get the desired result. So it's not just a simple matter of doing a training course and saying, off you go, without monitoring the practice that really follows.
Okay, but if that's what you need, you're talking about ongoing work within teams. Is it realistic to expect GPs to be able to do that? Or are you saying now that this really should be the preserve of specialists and we should perhaps be paying attention to whether or not those specialists are doing a good job?
Exactly. So what we need are specialist teams in our public sector, through our state hospitals and other groups, rather than saying, look, the GPs can follow up cases and may do a lot of the prescribing after specialist assessment, but the diagnosis and treatment in the first place needs to be done in really professional and careful ways.
So does that mean the New South Wales government's program, as currently stated, has got it wrong?
Well, I think what's being said and what they're saying is not exactly the same thing. So in the first instance, they're talking about follow-up prescriptions, which have been hard and been expensive. The second bit about who makes the diagnosis in the first place and who starts treatment, I think needs to be much more carefully thought through.
So, Professor, what are the alternatives to medication for those with ADHD?
Well, that's an important question. There are all sorts of other psychological approaches in enhanced education, focusing on sleep-wake cycles, trying to attend to those problems, and what other developmental problems a kid may have, what other learning difficulties, rather than simply thinking everything is ADHD when a kid has a problem with attention or problems with impulsiveness or overactivity in a classroom setting. So proper psychological care is an important part of the aspect, independent of whether you take medication or not.
Professor Hickie, thank you so much for your expertise.
Thank you.